If you are over 60 and you take even one pill every day, I need you to stay with me for the next few minutes. What I am about to share with you is something many cardiologists talk about quietly among themselves. It is not something that makes the evening news. It is not something your pharmacist always has time to explain, and it is certainly not something printed on the label in big letters. But it may be one of the most important things you hear this year. I want to speak to you today the way I would speak to a close friend, calmly, honestly, with care. Because what I have observed over many years of working with patients in their 60s, 70s, and beyond is that some of the most common pills taken by seniors in this country may be quietly increasing the load on an aging heart. Not in a dramatic way, not overnight, but slowly, gradually, in ways that often go unnoticed until something serious happens. And here is what most people do not realize.
The danger is not always in taking medication. Sometimes the danger is in taking the wrong medication at the wrong dose for too long, without anyone stopping to ask, is this still the right choice for this person, at this age, with this heart? That question is what I want to explore with you today. This is not personal medical advice. I am not your doctor. I do not know your full history or your specific situation. What I am sharing is general educational information based on patterns that many physicians have observed and that some studies have begun to document more carefully. Please always speak with your own doctor before making any changes to your medications. But please, keep listening, because what comes next may genuinely surprise you. Let me start by telling you about a patient I once spoke with. She was 68 years old, retired schoolteacher, lovely woman. She came in not because of chest pain, not because of shortness of breath, but because she felt off. Her words, just off. She had been taking several medications for years, one for her joints, one for sleep, one that had been prescribed after a minor procedure and never really revisited. And she assumed, as most of us do, that if a doctor prescribed it and she had been taking it for a long time, it must be fine. What we found after a careful review was that two of those medications were interacting in a way that was placing extra strain on her heart. Nothing catastrophic had happened yet, but the pattern was there, quietly building. She looked at me and said something I have never forgotten. She said, "Nobody ever told me these things could work against each other." And that is exactly what I want to talk to you about today. Here is the part that surprises most people. We often think of medication as the solution, and of course, in many cases, it absolutely is. Medication saves lives every single day. I believe in it. I have seen it work miracles. But after 60, the body changes. The kidneys process things more slowly. The liver works differently. The heart itself may be carrying more years of wear than it was when a prescription was first written. And what was a safe, appropriate dose at 50 may not be the same story at 65 or 70. This is where many seniors make a mistake. Not a careless mistake, a completely understandable one. They continue taking what they have always taken, without anyone pausing to look at the full picture. And the full picture, sometimes, includes something quietly working against the heart. Let us talk about 5 categories of medication that many cardiologists have raised concerns about when it comes to older adults. I want to be very clear. These are not medications that are always dangerous. They are medications that, in certain situations, at certain doses, taken alongside other things, may increase risk for people whose hearts are already working harder with age. Pay attention. One of these may be sitting in your medicine cabinet right now. The first one may surprise you. It is not something exotic. It is not a new drug. In fact, it is something millions of seniors take every single day without a second thought. Many people consider it so safe, they buy it without a prescription. They keep it in the kitchen. They take it with breakfast. I am talking about non-steroidal anti-inflammatory medications, the kind commonly taken for joint pain, back pain, or arthritis. You may know them by their common names. Many older adults take them regularly because, quite honestly, they work. They reduce pain, they make movement more comfortable, and for someone dealing with chronic joint discomfort, that relief feels like a gift. But here is what most people do not realize. Some studies suggest that regular use of these medications, particularly in higher doses or over long periods of time, may increase fluid retention in the body.
And when the body holds extra fluid, the heart has to work harder to pump it. For a heart that is already aging, already carrying a few extra years of effort, that added pressure may matter more than most people think. Many doctors have observed that in some patients over 65, frequent use of these pain relievers has been associated with elevated blood pressure, increased strain on the kidneys, and in some cases, changes in heart rhythm. It may seem harmless. You've been taking it for years. Nothing dramatic has happened. But what happens next is something many overlook. The effects are quiet. They are cumulative. And they rarely announce themselves until something bigger occurs. What can you do? The next time you reach for that pill in the morning, in your kitchen, before your coffee, pause for just 10 seconds. Ask yourself, have I told my doctor how often I take this? If the answer is no, that conversation may be worth having. There are alternatives for joint and muscle discomfort that some doctors feel carry lower risk for the heart. Physical therapy, topical creams applied directly to the skin, gentle heat, certain movement practices. The solution does not always have to come from a bottle. The second medication category is one that genuinely concerns many cardiologists when it comes to older adults. And this one is particularly tricky because it is often prescribed with the best of intentions. It is a type of medication used for sleep. Now I understand, sleep is not a luxury. Poor sleep in older adults is linked to all sorts of problems. It affects memory, it affects mood, it affects the immune system. So when a patient cannot sleep and a doctor offers something to help, the intention is entirely good. But certain sleep medications, particularly older ones that have been around for decades, belong to a category that many physicians now approach with caution in patients over 65. Some studies suggest that these medications may affect the electrical signals in the heart. They may slow certain processes that a younger heart handles easily, but that an older heart may not manage as smoothly. And here is the twist that most people do not expect. It is not just the heart. Some of these medications may also affect blood pressure regulation during the night. While you are sleeping, when no one is watching, when the body is supposed to be recovering. I have spoken with many patients who describe waking up feeling strangely tired, even after what seemed like a full night of rest, or feeling slightly dizzy when they stand up from bed in the morning. These experiences are sometimes brushed off as just getting older, but in some cases, they may be a quiet signal worth paying attention to. The small action here is this. Tomorrow morning, in those first few minutes after you wake up, before you stand up from your bed, sit on the edge for 1 full minute. Let your body adjust. Notice how you feel. If you regularly feel dizzy or lightheaded in those moments, that information is worth sharing with your doctor. It takes 1 minute, it costs nothing,
but it may tell you something important. The third category is one where I want to be especially careful with my words, because the medications involved are genuinely important for many people. They are widely used. They are often necessary. But there is a side of this story that does not always get told in the examining room. I am referring to certain medications prescribed for anxiety or emotional distress. Long-term use of some of these medications, particularly in older adults, has been something many cardiologists have watched closely. Some research suggests that certain compounds in this category may affect the rhythm of the heart over time. Now, I want to say this clearly. Anxiety is real. Emotional suffering is real. And for some people, these medications provide essential relief and stability.
I am not suggesting anyone stop taking them. I am absolutely not saying that. What I am saying is this. If you have been taking this type of medication for many years, and if that prescription has not been recently reviewed by a doctor who knows your current heart health, it may be worth asking for that review. Here is what may happen if this goes unaddressed. Some studies suggest that long-term use in certain older adults may be associated with subtle changes in heart function. Not dramatic, not always immediately noticeable, but the kind of quiet, gradual shift that over months and years may contribute to a larger picture. This is where it gets concerning for people over 65 especially, because the heart at that age is already navigating changes on its own. Adding another variable that places even small demands on cardiac function is something worth understanding. The simple action here is one conversation, one appointment. Ask your doctor specifically, is there anything in my current medications that you would want to review given my age and my heart health? That one question can open a door that many patients never know to open. The fourth medication on this list is perhaps the most unexpected, because this one is often considered a symbol of healthy living. Many seniors take it as a supplement, not even as a medication in the traditional sense. They read about it online. A family member recommended it. It feels natural and safe. I'm talking about certain herbal and over-the-counter supplements that interact with heart-related medications in ways that are not always obvious. Some of the most commonly used supplements among older adults, things like certain herbal remedies for energy, products marketed for circulation, or even some vitamins taken in very high doses, may interact with medications for blood pressure, blood thinning, or cholesterol in ways that change how those medications work. And this is the part that surprises most people. Because you go to your doctor, you list your medications, but you may not mention the supplements because they feel different. They feel like food, not medicine. And your doctor may not always ask. But some studies suggest that certain supplement-drug interactions may affect the way the heart receives and responds to its prescribed medications. The blood thinner that was carefully calibrated for your body may behave differently when combined with certain herbal products. The blood pressure medication you have trusted for years may become slightly less effective, or in some cases more intense, depending on what else is in your system. I have seen this pattern more times than I can count. A patient whose numbers were stable for years suddenly shows unexpected changes, and after a careful conversation, we discover a new supplement they began taking 3 months earlier. The action here is simple and takes about 30 seconds. Make a complete list right now of everything you take. Not just prescriptions, everything. Vitamins, supplements, teas, herbal capsules, anything you take regularly.
Bring that list to your next appointment. Show your doctor the full picture. 30 seconds of list making may prevent a significant problem. The fifth and final medication category is the one I find myself discussing most often, and the one I think is most important for you to understand. This one involves medications that were prescribed appropriately, at the right time, for a legitimate reason, and that have simply been continued far longer than may be necessary or safe. Let me explain what I mean. When a patient is in their 50s, a certain blood pressure medication may be exactly right. The dose is calculated based on kidney function, weight, and overall health at that time. 5 years later, 10 years later, those factors have changed. The kidneys are slightly less efficient. The body processes the medication differently. But the prescription has not changed. It has simply been refilled, again and again, without a full reassessment. Many doctors have observed that some older patients are actually over-medicated in ways that were never intended. Not because anyone was careless, but because medicine is busy and reassessment takes time, and patients often assume that if a prescription is being refilled, someone must be watching the numbers. But here is what many people overlook. Over-medication for blood pressure or heart rate in older adults may sometimes cause the heart to work in ways that are actually less efficient. Blood pressure that is pushed too low in a 70-year-old, for example, may reduce blood flow to critical organs, the brain, the kidneys, the heart itself. Some studies suggest that this phenomenon, sometimes called overtreatment, may be more common in seniors than many people realize, and the signs are quiet. Fatigue, a feeling of heaviness, slight confusion at certain times of day, things that are easy to dismiss as simply getting older. But it may not just be aging. That is the twist. That is the thing most people are not told. If you are over 60 and you have been on the same prescription for heart or blood pressure management for 5 years or more without a detailed review, you may want to ask, gently and directly, whether your current regimen still makes sense for who you are today. Not who you were when the prescription was first written. Who you are now. Now I want to take a moment and speak to something deeper. I have worked with patients in their 60s, 70s, and 80s for many years, and one thing I have noticed is that older adults in this country are often extraordinarily trusting of their medications. They take them faithfully. They never miss a dose. They are, in many ways, model patients. But that trust, while beautiful, can sometimes work against them. Because the system is not always set up to look back, to ask, is this still right? To sit down with a patient who has been on the same 5 medications for a decade and say, let us start from the beginning and make sure every single one of these is still serving you. That is not a criticism of doctors. Most doctors I know are dedicated, caring, and working incredibly hard. It is simply an honest observation about a system that is built around moving forward, not always pausing to look at the full picture. And that is why I am talking to you today. Because you can be the one who asks the question. You can be the one who brings the full list. You can be the one who says, can we review my medications with my heart health specifically in mind? That is not a complicated request. It is not asking for anything unreasonable. It is advocating for yourself, and you have every right to do that. Let me paint 2 pictures for you, 2 possible futures. In the first picture, nothing changes. You continue taking everything you take today, at the same doses, without any review. Maybe everything is fine. Many people are fine. But for some, the quiet buildup continues. The fluid retention edges upward. The blood pressure fluctuates in ways that go unnoticed. A supplement interacts with a prescription in a small but meaningful way. And one morning, something happens that might have been preventable. In the second picture, you have one conversation, one appointment where you bring your full list, ask your specific questions, and invite a fresh set of eyes to look at your full medication picture with your age and your heart in mind. Maybe nothing changes. Maybe the answer is everything looks good. But maybe one small adjustment is made. One medication is reconsidered. One dose is refined. And that small change over the months and years ahead may be the difference between struggling and thriving, between independence and dependency, between a heart that is quietly carrying too much and one that is given a little more room to do its best work. That is not a dramatic outcome. It is not a miracle. It is just careful, attentive care. And you deserve that. Before I close, I want to remind you of something. The goal of everything I have shared today is not to frighten you. Fear is not useful. Fear does not make good decisions. And nothing I have described today is a certainty. These are patterns, possibilities, areas of concern that many cardiologists have raised and that some research has begun to support. Your situation is unique. Your body is unique. Your medication history is something only your doctor can fully understand and evaluate. But knowledge is not the same as fear. Knowing that these conversations are worth having is not the same as knowing something is wrong. It is simply giving yourself the best possible chance to stay well, to stay strong, and to stay independent as long as possible. And for most of us over 60, that is exactly what we want. Here is what I would like you to do after this video ends. Find a piece of paper or open a note on your phone. Write down every single thing you take regularly, every prescription, every over-the-counter medication, every supplement, vitamin, herbal product, and anything else that goes into your body on a regular basis. Then, at your next doctor's appointment, look your doctor in the eye and say, "I would like to review my medications with my heart health in mind. Is there anything here that you would want to reconsider given my age?" That is it. That is the whole action. It takes less than 1 minute to say, but it may open a conversation that has genuinely needed to happen for a long time. You have taken care of so many people in your life. You have shown up, worked hard, and done what needed to be done. This is a moment to take care of yourself with that same dedication. Your heart has been working for you every single moment of every single day of your life. Give it the attention it deserves. Thank you for listening, and please, as always, speak with your own physician before making any changes to your medications. This video is for educational purposes only and is not a substitute for personalized medical advice. Take care of yourself, and I will see you next time.